that works for you, and making sure that you enjoy the little things that you do as a GP, rather than just being one GP in a salary practice. You have different things that you're doing, and I hope you go forward to enjoy your career. In Elite Exams, I am also the director and admin lead. I work on strategy, content, bringing people to the table just like this to make sure that I am helping yourself and our colleagues who are preparing for the exam. Content and a lot of consultation guides videos. We curate a list of learning resources and we post in our private group to get the doctors to prepare for the session. And then when we come together on Monday, we learn as a team. So it's a really small, intimate group because we really want to nurture the success of our colleagues who join us in sessions. So if you're here and you haven't joined a session like that with us, again, number 3, pinch yourself. It's like we're going to have a lot of pinches today to stay awake. So I hope we are just going to engage with the session. So first thing we're going to do in the chat, which is orienting ourselves where we are today, what we're going to use for communication. In the chat, in Zoom, my WhatsApp is closed, everyone. So we're going to work in Zoom today as a team. Say hello. I've got my eye on the chat. So how are you feeling today? I've said hello, my own. So say hello. 2 questions. How are you feeling? Pick one you want to answer. How do you feel towards preparing for your exams? And many people say, sometimes I feel prepared, but I'm confident that I'm going to make it. And yeah, we all know that anxiety can come in and we always have that thought. But we want to support you to make sure that we're passing. Oh, and also says feeling anxious. Anxious is a human emotion. It's a human response. So if you're feeling anxious, don't feel like you are alone in this. There are many people feel the same way. The important thing is that you are preparing for the exams and you are having the right skills. So we have more people feeling anxious. I might move over to the boat of feeling anxious in solidarity, just to let you know that I was in your shoes one time. Anybody else feeling something else? Is somebody feeling very confident and ready for the exam? Because I need a co-host. I need somebody to sit in this chair with me and co-host this session. Anybody? Or anybody just starting preparation for the exams? Here is a supportive space. There's no right or wrong, but it's getting you to think about where you are. Then the second question after that would be, what do you need at this time to prepare for the exams? So this is the different things we do. And I always talk about this as an intro. There are different platforms. If you find that you're identifying that there is a big learning gap, then you might need to go for some lectures. But if you're finding that you're doing role play, there's no gap in your clinical management, but it's more about your structure or more about your communication skills, then you're in the right place. Because that's what we do here. We are not here to summarize nice CKS for you. Yes, we need to know the evidence-based medicine, the clinical management relating to that case. But what we do here in Elite Exams is get you to understand examination technique, best practice when communicating with patients, or managing a certain scenario in clinic. And I always say that if something is common in clinical practice, by proxy, it is common in the exams. So if you ever sit in your clinical practice, and you say, I've just had a case of pregnancy and I struggled in managing nausea and pregnancy in vomiting. When you go back and you study, so this is exam tip number 1, when you go back and you study, also think about what other common pregnancy cases can I see in my exams? And that's right there, you will end up covering a lot of things in your curriculum if you take that kind of approach, rather than just studying nausea and vomiting in pregnancy and leave it like that. But what about dyspepsia? Or what about pelvic girdle pain? Or other common conditions? According to the NICE, there's a list there. Other common things that can present in pregnancy. So we want you to have a lot of exposure and learning as you prepare for your exam. So I would say stressed, but still managing to hold. Oh, bless you. I wish I could help you hold your head, but yeah, I can probably send you some paracetamol, but keep at it. Manage your well-being, manage your stress as you prepare for the exams. So we encourage you to subscribe to us. I'm going to post the link shortly in the chat, and when the session starts, subscribe. If you've noticed, we've been making a lot of changes. I've got a team. We're starting to send out examination tips by emails, examination advice, case studies by emails, resources, just trying to bring it closer to you in your inbox, so that you are really learning. So please subscribe to whichever platform you feel you're comfortable with, because we have different ways of making sure you get that learning material, and we'll connect with you as time goes on.